The first Millennium Challenge account, worth around $360 million enabled Lesotho to build 170 health facilities around the country, a much-needed boost for the kingdom's ailing health systems. But the infrastructure alone without appropriate systems is a problematic exercise.
When an individual goes to a health facility to seek for medical attention, the record cannot really be kept if that person moves to another health facility. So with ICT, we'll be able to ensure that we are able to track an individual.
We should be able to strengthen the system so that we are able to deduce what it is that we are seeing. We sometimes may be labeled as a violent nation without documenting what it is that is showing that we are violent.
It is building upon the past successes that has impressed upon the compact to reconsider Lesotho for the second round of the funding eligibility.
Around 60 or 70 health centers throughout the country were built, and the government of Lesotho, through its own funding, built an additional 40 health centers. So all in all, a total of around 150 to 170 health centers were developed.
But the era of coronavirus is dictating new terms to primary health provision, information sharing topping the list.
What we are seeing is that if you can get information to people, particularly around how to prevent and avoid infections, you can bring down the costs of treatment, number one. Number two, you can also avoid unnecessary economic disruptions, lockdowns and things like that. So the main thing that came out of COVID is that prevention is better than cure. And that's why we are hearing in this workshop that people are talking about how do we get information to people in the rural areas, in the villages, quickly, correct information, and what role can village health workers play in that role.
The coronavirus has taught us differently that provision of health services will be something that needs to be taken into consideration in order to prevent the future pandemics. Rapelang Khatebe, SABC News, Lesotho.